this is your Houston chiropractor, Dr. Gregory Johnson. We have Sheila here with us today, and Vladdy too. He's in the background for right now, but we're going to have him out in front in a little bit showing you how to pull her hiatal hernia down here. She's a gospel singer that drove all the way down here with Vladdy, her husband, from Nashville, Tennessee, and they spent a couple days getting here. But they came down here specifically to get evaluated and treated for your hiatal hernia, right?
Yes.
Okay, so today what we're going to do is something a little different and unique that we haven't done yet, and that is I'm going to show you how we diagnose the underlying cause of why she has the hiatal hernia. Not treating the hiatal hernia, the disease itself, but treating what's causing that and finding out how she has that in the first place. So I'm going to run you through the diagnostics that we do on that and the tests that we do, and we'll get started right now. So Sheila, the first thing let's do is check your posture in the mirror here. Yep, so we'll have you put your feet shoulder width apart and just relax your arms, and I'm going to have you close your eyes and flex your head forward and backwards for me, please. So the first thing that we always do, as usual, to check for biomechanical integrity, three-dimensionally, is evaluate her postures on the X, Y, and Z axes. This is BioPhysics, and it is very accurate for determining biomechanical improprieties, posture, because the spine is a mirror of its posture. So I could take her x-rays and it would look exactly like her posture. So that's why we don't have to take x-rays on every patient unless they've been involved in some kind of trauma or head pathology. So she's got just a little bit of forward head posture, not too bad. A little bit of rotation, I think that's just from how she's been sleeping. A little translation of her pelvis to the left of center here. So you got a little more space over here than you do over here. Okay, so let's have you, we're going to have you line your back right here with your head up this way first. Now I'm just going to show you some diagnostic tests that we do on new patients just to evaluate them for any spinal biomechanical improprieties, which are also called subluxations. Subluxations entail a misalignment of one or more of the 24 freely movable vertebrae of the spine and or pelvis, 3 bones. Now as I lift your leg up here, is there any pain in your low back or leg shooting besides the tightness in your hamstrings? Okay, and so we're down here, it feels easier, right? Is there any pain in your back or leg when I do that? Okay. So she has a negative straight leg raise test and Braggart's test on the right. Now I'm doing a Fabry-Patrick test, which I'm testing her hip joint. Is there any pain in your actual hip joint or your back when I do this? In your hip in here? Okay. So that's a positive Fabry-Patrick test on the right that detects actual hip joint problems. So we're going to do the straight leg raise on the left side. And patients always have a tendency to want to bend their knees, keep their knees straight. And she's got very tight hamstrings, so that probably hurt your tightness in the hamstrings. But was there any back pain when I did that?
No.
Okay, does it feel better down here?
Definitely.
Okay. And then, is there any back pain when I do that?
No.
Okay. Let's cross this over here and let that flop down. And do you feel any of that same hip pain when I push down on this side as you did? You do? Right in the actual hip joint too? Okay. Most people think their hips are back here. That's not. That's the sacroiliac joints. The hip joints are right here where the femur attaches into the ilium. So that's where you have your ball and socket right here. That's the actual hip joint. So she's good with all that, except she's got a little bit of discomfort on her Fabry-Patrick bilaterally. So look at this. This is really important. We test and look at the patient's biomechanics of their rib cage, because the underlying cause of hiatal hernia is not just pressure in here or acid going up into the esophagus. It's a mechanical problem, in this case biomechanical, because look at her rib cage on her left side here versus her rib cage on the right side. Look how high my hand is on this left side of her rib cage versus my hand on the right side. There's a good half-inch difference there, and you can tell that by my thumbs. Right here's the very end of the sternum, or the xiphoid process, and that's where we kind of start that measurement. And then her rib cage, I just follow that with my thumbs down, and you can see my hand fitting on that. Now hers is not sticking way up on one side or the other like Bo's was. She's got a little elevation on this left side, And that's where you feel most of your pressure too, right over here, huh?
On the right.
On the right side, okay, so that's wrong. So she got down on the right side, so her rib cage is lowered on this right side, so that's where she's feeling the most pressure. And there we go. Okay, that's a little knotted up right there today too. Okay, so let's do this now. Let's have you sit up and face towards your knee. There we go, that way, good. And here we go. Now, I'm going to do a compression test of her cervical spine. Is there any pain anywhere in your spine there? That's usually negative on most patients. Now we're going to do a maximum foramina compression test, and then go back into the right. Did that hurt a little bit in your lower neck? Okay, so positive maximum compression test on the right, and also on the left there too, right? You feel that down here as well? Okay. Now we're just going to do a right head tilt. Is there any pain or tightness in there? How about when I do that? Does that elicit a little bit more? Okay. That's a positive shoulder depressor test. Now she's going to do still left lateral flexion. Any pain there at all? How about when I do this? Not as bad as over here, was it? Okay, so she's got a negative shoulder depressor test on the left. So let's just turn your head left, like you're looking left for me. Now watch your range of motion here to the left. Now go to the right. This is the way she sleeps all the time. So you can see she's got a much greater range of motion to the right than she does the left. Okay, you can look straight ahead for me now. And I'm going to do a deltoid test right now, which will test the C5 nerve root. So I'm going to push down, hold that. Excellent strength, good, strong. And I'm going to push down here, hold. So she's got good deltoid stability, 5x5 on her muscle strength. Now I'm going to test her bicep on the left. I'm going to pull out and resist. That's good. Now I'm going to reposition you, and I'm going to push in, test your tricep. Excellent. So now I'm testing her bicep and triceps, which is C6 and C7. I'm going to pull out, resist, good. Now I'm going to push in and resist, good. So those are 5x5 as well. So now we're going to check her reflexes bilaterally. You always check these bilaterally to compare. Just let that relax right in my hand. There you go, good. There. You want the patient to totally relax on these. That's the best way to elicit a reflex. And she's got +2 reflexes on the right upper extremity. Perfect. There and there. So she's got +2 equal and active from side to side. So that means she's symmetrical in her nerve supply in the cervical spine. Her patellar reflexes are fine. +2 equal and active. Same thing with the Achilles reflex down here, which is S1. That's very good on both sides. You feel those jerk? Yep. Oh, see, there's a problem right there. Nope. I'm glad he's looking at me a little funny now. Okay, so let's come over here on your tummy now. And now this is a very important aspect of the examination process for the causation of hiatal hernia, which is really where the diaphragm weakens and lets the stomach slip up through the hiatus into the esophagus area. So again, we're going to check her rib cage alignment on the bottom, just like we did on the front. And you're seeing just a little bit of elevation of the rib cage on this right side, and it hangs down a little bit lower here. And that's a little tender right there too, huh? Right at the base of your rib cage right there. On the right, you don't feel it that much? Okay. It's just tighter on that side, so I'm feeling a little bit more, and tighter right there too. Now, we tested her leg length earlier today, and she is short on the right by about 1/4 inch. That's not bad. We bring it up, it gets even, that tightens up a little bit in your low back right there. Yep, so that's her right leg short by 1/4 inch. We bring it up, it gets even. That's a positive knockless, plus that raises the pelvis up and tightens up the lumbopelvic musculature. That's a positive knockless test. And it's a positive Deerfield on the right because this leg actually got even with this one, telling us this is not an anatomically short leg. It's coming from a functional misalignment of her sacroiliac joint here on this right side, which I'm sure that's a little tender right there. Feel that one? Not that bad, not like it was this morning? Tender. Okay, right here? Yeah. She's actually got bilateral sacroiliac subluxations or misalignments. When we say subluxation, that's a multi-pronged thing. That's not just a misalignment of a vertebra, it's a misalignment of a motor unit, that causes a neurological interference of the nerve coming out between that motor unit, which is made up of the vertebra above and the vertebra below. So now I'm palpating her lower lumbar spine. She does have L3, 4, and 5 misaligned here. Not too bad though. They're twisted a little bit to the left, which makes the muscles stick out a little bit more on the right, so it's a body right. And we check her spine for a curvature or scoliosis, and she has a tiny bit, and it's right through this thoracolumbar area right here, which is right where that diaphragm attaches. So this is important, right through here. You see that little curve right there, Laddie?
Mm-hmm.
So did you feel any of that when I went through there? Could you feel that curve or no? Not that much, yeah. Sometimes patients can feel it, sometimes they can't. Depends on, now her curve's not that big, and it's not that accentuated, so, but she can feel these golf ball knots up in her shoulders, I bet.
Yeah, they've been hurting a lot.
Yeah, these guys here are tight and tense. These are trigger points in her trapezius muscles and levator scapula muscles. Now I put the head forward just a little bit here to open up the joints in her neck and her upper back. And she's also, when I'm palpating her cervical spine, she's got misalignment of occiput and C1 right here at the base of her skull, especially on that right side, and that's where she gets some headaches starting right here and going around into her temporal region, just in the right side right down here, too sore, huh? Feel that one? Yeah. So we're ready to start adjusting her now. So I'm going to adjust her sacroiliac joints first with the drop piece. Now the sacroiliac joint is a kind of a diagonal 45-degree angle joint right in the pelvis. The big ilium bone here with the sacrum, therefore sacroiliac joint. People say you can't adjust the sacroiliac joint or get movement. That's just not true. It does in fact slide. It's one of the largest joints in the body. I know the knees, when you Google the largest joint in the body, you'll put all up the knee. But as far as true sheer size, the sacroiliac joints themselves are truly the longest joints in the body. The knee's more complex than the sacroiliac joint, but now I'm adjusting her sacrum straight superior to inferior on the y-axis. And we get the base squared away. Then coming straight down on L5, that was a little tender. There's L4, that was also probably a little tender. There's L3. And I just keep working my way up, and you notice the angle on my arm changes as I move up the spine. And then we get into her lower thoracics, and I want her just to breathe normally. Now I'm not putting a great deal of thrust in these right now. I'm just putting some steady pressure with the right angles. Excellent. Perfect. Good job. Just keep exhaling. That's the girl. That's it. Now she's moving from bottom to top really well. And I bet you her legs are even now. Yes, they are. And I bet you this a little less tight than the last time.
Yeah.
Okay, so
Oh, wow.
I am not doing the turbinator on her because she's too nice a lady and she doesn't have that many huge trigger points. So I'm going to do the genie rub, which is really a deep vibratory percussion type of a instrument that increases blood flow into the tissues and the joints where I'm running it. A lot of people, patients will feel a sense of warmth or heat in their muscles and joints. Sometimes itching occurs. Now this, when we do this on Brooke, she gets itchy. You have to scratch her back for her. And then, but she'll be back in for a video here soon too, guys. I know y'all looking for her videos all the time, but she'll be back in here soon. She's been at a lot of activities with her wrestling. She just won another championship. Are you feeling any itching at all when I do this on your skin?
Feels fabulous.
Feels fabulous, yeah. That's what we usually hear. Everybody loves this part of it. Everybody calls this my buffer. Just priming her for the finished product that we're going to paint on her, which is a better biomechanical alignment and three-dimensional gravitational weight-bearing compression stress. That's the key to correction of the spine in biomechanics for chiropractic, is to correct the spine in all three axes so that it is strong and stable with gravitational weight-bearing compression stress, rather than being misaligned and weak and unstable. And gravity will win that battle over time. That's why you see people's postures changing from an upright posture as they're younger to, as they get older, developing this forward posture that you see in elderly people. So, legs are even still. That feels pretty good. Any pain there at all?
Not like it was.
Okay, great. Okay, let's have you turn on your back now. So, now we're going to adjust her cervical spine. There we go. Yeah, just let this relax right in my hand here. Perfect. That was her atlas and occiput and C2 on the right. And that was the atlas and C2 on the left. And we've already decompressed this. I'm just kind of putting the cervical curve back in here. And then we make sure her shoulders are stretched out and spread apart. Good. Now, I'm going to lift this up just a little bit so your head's level. And Vladdy, you want to come over here? This is her husband, Vladdy, and we are going to be teaching him how to help Sheila when she gets home. So, what we do is we find the sternum here, and then you go all the way to the very tip of the sternum. You find the xiphoid process, which is a little tip right at the very end of the sternum. Then you go right below that with your 3 middle fingers. By the way, only chiropractors should be doing this at home. And you find that soft spot. Take a deep breath in for me, Sheila. And I put my pisiform right over top of that, and I grab the top of the stomach, or the fundus of the stomach, and then I pull that straight down while the patient is continuing to exhale. So let's do that again. Inhale. And let it all the way out. There we go. Okay. So I'm going to have Vladdy come in here now. And he's right-handed as well. So we've taught him this morning where to find the end of the sternum and then go right below that in the soft spot. Down just a little bit. Yep, right there. And then, so what I'm going to do is just help him with the pressure so that he kind of knows the pressure that he should be using. So take a deep breath in first. Go ahead and try that again. And now, we're going to go straight down first. You get the top of the stomach, and then you pull it down. Now, you want to stay away from the right side over here because the liver and gallbladder are over here. So we stay a little bit to the left of center right here, and I usually do a little twist. Did you feel me twisting your hand there? But you got a good pull on that one. Did that feel deep?
Got a great strength.
Did you feel the top of the stomach there?
Yeah.
Yeah, so it's really not that hard. Why don't you go ahead and do it by yourself this time and see how she feels with that.
I just had a hard time of finding the
end there. Yeah.
You know, like I can feel it on me very good,
right.
But on her I can. So I just want to make sure that she knows also where I'm.
Yeah, and she can help you with that placement too.
You know?
She's going to know by now, yeah. So as long as you're down below it, is he down below your xiphoid there? Okay, so you get that soft spot there, yep. And so you go in slow, you don't go fast in, and then you grab it and you pull down while they're exhaling, and you really got to pull it down hard because this thing has slipped up through her diaphragm, the hiatus, and it's gotten stuck up here. That's why she feels that knot feeling and that pressure feeling right in her lower sternum, right below her sternum, and then the rib cage here. Now I want to just look at something here. And look at the rib cage alignment right now versus just a few minutes ago. Look at the difference. I mean, the rib cage is, right now is about 1/4 of an inch short now compared to 1/2 an inch just 5 minutes ago. So we've got excellent realignment on the rib cage. The mechanics of this to correct the underlying cause of hiatal hernia is to correct the spine alignment in the thoracic, mid-thoracic, lower thoracic spine. then correct the costovertebral joints, which are in the back where the ribs meet the vertebrae. Then come up to the front and correct the costosternal joints, where the ribs attach to the sternum. And then pull the stomach back down through the hiatus so that the diaphragm then can re-strengthen up through its newer, better aligned attachment, which is the lower rib cage all the way around. That's all cartilage. So it attaches there. That's the basis behind a long-lasting correction of hiatal hernia, is you got to pull the stomach down. That's why we're teaching Laddie here to do this when she gets home, because we're seeing her twice a day for this 4 days this week. However, that's not going to be enough to continue this process when she gets home, because her body's been out for years now. So we're going to need to continue that process, and she'll need to find a good Palmer graduate up in the Nashville, Tennessee area. So Bo, if you're listening to this and you know somebody, you found somebody up there, let us know. He's from Nashville too. And or if you're a chiropractor from Nashville and you graduated from Palmer College of Chiropractic, get a hold of me at yourhoustonchiropractor@gmail.com. Perfect. Good job. Yeah, let me help you up here. And let's face towards Renee. And I'm going to scoot you back this way just a little bit. We're going to check her shoulders and adjust her shoulders, elbows, and wrists now. Okay, she'll need a lot on that right shoulder. There we go. Okay. There we go. Got her right elbow really good and her right wrist. Now some of this is a little scary when you first get it done, because you're not used to your joints popping and moving like that, but I don't ever put a joint in a traumatic type of a position. I was in the martial arts since I was 13 years old, so over the 30 years that I practiced in martial arts with getting my 2 black belts, you really learn the in-play of all the joints and the range of motion of the joints, so you know where to break them, and then there you know now how not to as well. So martial arts has actually made me a better chiropractor. Palmer College of Chiropractic gave me all the training I needed. And Sheila, would you mind sharing with our YouTube subscribers and viewers? None of this has been scripted, right? I never met you before this morning, did I?
No.
And we didn't script any of this afternoon.
No.
This is all off the cuff. But would you mind just sharing with our viewers how this has been for you, and is this worth the trip for you to do this? And
Absolutely. Every bit worth the trip to come out and learn new things and how to deal with hiatal hernia.
And you have been under treatment for this for how long up there?
I've been going through it for quite a while.
What, several years now?
Well, I've been dealing with it, I believe, probably half of my life, just now knowing the extreme of it.
Right. And so far you've taken mostly herbs and natural solutions, which I commend you for. So really the only medical alternative for this is pills and surgery. That's all they have to offer for it, is pills and surgery. And believe me, most of the people we hear from, they have already had surgery, they've already taken all the pills, and that doesn't fix them. It's only changing chemistry, and it's not really balancing the chemistry naturally, so it doesn't work. Now, we did add a regimen to her chemistry today, which is 100% natural sea salt. If you take about a quarter teaspoon of that and put it in a little cup, like a coffee cup full of hot water, and then you stir that up to where it melts, and then just take it, put it in your mouth and swish it around so it gets under your tongue. That's a sublingual reflex. And then swallow it. Then that helps your body go into an internally pH base environment as opposed to an acidic environment, which she's in right now. And you can do those by little test strips that you get and test your pH on the tongue. So we got one more thing to do and we're done. Let's come over and shoot you. She come all the way down here from Nashville singing gospel music. I'm going to shoot her. Welcome to Houston. All right, so we're going to shoot her with the nice gun, though. Yeah, I know. Okay, I'll turn it down a little bit for you this afternoon. There we go. Now, let's have you flex your head forward and backwards again. So what we're doing with this is called neuromuscular re-education. We're actually going to be retraining her cerebellum, how to remember being in place as opposed to out of place. So let's have you pull your shoulders up and back like this, pull your hands back like this. Then we're going to bring your head straight back in the Z-axis and then a little bit left on the X-axis here. Now I want you to shift your pelvis straight to the right for me. There you go. Hold that right there for just a moment while I tap this atlas on the side angle right there. That's the X-axis. And I'm hitting the atlas straight on the lateral mass. And then hitting right at L5S1. Okay, now you can relax. And let's try that very same thing again, see if this feels any smoother to you. Yep. Take a look. See, you're right down the center now. Still need to come a little bit right on your pelvis, but we've got more room here than we had a few seconds ago. So we're actually starting the process of re-establishing her biomechanical alignment in gravity three-dimensionally on the X-axis, the Y-axis, and the Z-axis. So we've still got some work ahead of us, but thank you, Sheila, for sharing your story with everyone. And we would let you sing, but Renee's arms are about to drop off right now, so we're going to let you go. This is your Houston chiropractor. We'll see you next time.